This time I'd like to introduce Mayor Call. Mayor will lead us in prayer and also the pledge. Mayor? We don't have flags.
Uh-oh. Epic fail, no flag.
Well, we'll pretend. I'll stay.
Yeah, we won't do that since we don't have a flag. Please bow your heads. Heavenly Father, thank you for giving us the opportunity to gather here today. We ask you to guide our hearts and our minds in the spirit of doing what's best for the greater Peoria region. May everything we do begin with your inspiration and continue with your guidance. And as a special intention, Father, I pray for peace and strength for Detective Bob Vester's wife, Kayla, their 2 young sons, and the entire East Peoria Police Department family as they struggle through these difficult times. Help them understand we're all here to serve your will, and please comfort them in their time of sorrow, and may the memories of Bob turn our tears of sorrow into moments of laughter and joy. We ask this in your name, amen. Just real quick, I asked Rick if I could just take a second to touch on that. It's been a really, really tough week, and those folks have a lot of tough days and months, and if I had to guess, possibly years ahead of them. So just ask that everyone keep them in your prayers. But more importantly, I just want to say thank you. You know, it has been a difficult week, but I can't thank the the critical team at OSF for all they did. Nothing short of phenomenal what we have in this region, and today couldn't be more fitting to learn more about everything going on. We really are blessed to have all the medical facilities and the treatment and the care that's available for all of us right here in this region. You know, they did everything possible, humanly possible, to save his life, and it wasn't meant to be. I personally feel like, based on the events, he's certainly in a better place. I hope he's looking down, agreeing with that. But I want to thank all the other surrounding agencies, because we had a procession escorting his body from OSF to the funeral home yesterday. And by everyone stepping in, it allowed every single officer on our department to join in that procession, be part of that. So I can't thank Peoria Police Department, Illinois State Police, Tazewell County Sheriff's Office sent deputies into East Peoria to take care of business for a couple hours while we're tending to that. And then OSF, the light flight crew, they came down when they saw us lined up. Not sure if they were the same folks that took care of them last Saturday night, doesn't matter. But we greatly appreciate the support, and I can't thank the community. I apologize if I've ignored phone calls and emails this week, but my time was spent with the family and the officers, you know, as we're up there trying our best to figure all this out. But I just want to say thank you to everybody for your support, your prayers, and all the love that you've shown the East Peoria Police Department and the Vester family. So thank you.
Thanks, Rick. Thanks, Mayor. True statement that we are so blessed with the medical community that we have here, and it's we need to talk more about it. So with that, I'd like to introduce Michelle Conger from OSF, the President and CEO, officially now. Yeah.
Thank you. Thank you. Good morning, everyone. Very honored to be here. Thank you for that story as well, Mayor. That was really touching, and I think what the community is about. So really, really appreciate it when we can all come together. For those of you I haven't met, I'm Michelle Conger. I have worked for OSF for 32 years. I am from Peoria, graduated from Woodruff, went to ISU, then went to U of I, so sort of an Illinois person. Very committed to our community and really excited to just give you a little flavor of where we're going in terms of the future. I always start with this because these are the 5 sisters that sit on our governing board. OSF stands for Order of St. Francis. We are a Catholic organization, and sometimes people ask me if the sisters are involved in our ministry. They absolutely are involved in our ministry. They run our ministry. I know who my boss is. And they are fantastic, but I think the beauty of it is the mission of OSF has never changed. It is to care for persons with the greatest care and love, and that will never change. So I'm going to talk to you about a lot of change and a lot of things that are changing in healthcare and in OSF. I'm really proud of the fact that we have the base that we have in our sisters. This is just a snapshot of OSF. While our largest facility is located here in Peoria, we do have 18 hospitals. So it gives you a feel for where we're located across the state. And then we're largely based in Illinois. We do have one hospital that is in the Upper Peninsula of Michigan. We do operate all of our shared services out of Peoria. So this is where we have all of our IT services, all of our supply chain services, all of that is located in the Peoria market. The only thing that's really changed on this, I'll highlight a couple things from the last time I was here. We did bring an additional hospital into the system in Dixon, Illinois, in northern Illinois, so we're really happy to welcome them to the OSF family. They were an independent hospital previously. And then one other thing that's happened as well is in Peru, their hospital, Peru and Spring Valley, were a single hospital system, and that hospital closed. We did buy their assets in Peru, and really excited to say we reopened that this year. So that community now has healthcare again, so really excited for that. We have about 27,000 mission partners. We refer to our employees as mission partners, largely because we consider ourselves a mission, not a business. And so, they're scattered throughout Illinois in the Upper Peninsula. Really excited about some of the recognitions we've received, really around being a top employer for women. Now, I'm pretty excited about that as well. I'm the first lady who has gotten to run OSF Healthcare, so really is a fantastic place for women to grow in their career. I started as a clinician at OSF and got to work in many different locations, so I'm really excited to receive this honor. I put this in here. This is really about the economic impact to Greater Peoria, really recognizing that healthcare is a big growth pool for our region, and really looking at that impact. So of the mission partners I mentioned, we had 27,000 of them. About 13,000 of them actually work in this area, so really are located in the Peoria area. Served about 300,000 individuals, provided care for them over the past year. If you look at OSF in total, we serve about 1.2 million lives across the state of Illinois, so seeing a significant volume of people in this region as well. We have 1,200 physicians that are employed by OSF and are employed in this region, and then 88.7 million in terms of our return to the communities in terms of our investment. Last year, I was really excited, and I talked to you about some of the subspecialty care that we've been developing. We like to call it destination services. And when we say destination services, these are services that people typically, they're complex. You have to do a certain volume of them to do them, and people will travel to get these types of services. So I'll hit on them just at a high level in terms of what we've been working on. We talked about our Cancer Institute. Really exceptionally proud of this. I was talking to someone actually before I came up here, and we were talking about the proton beam. And she said she had been at a conference, and Northwestern was there, and we're telling people that they had the only proton beam in Illinois, and she promptly corrected them because we have a proton beam here in Peoria. So this is really fantastic for people because you have to get care, even though it's a short duration of treatment. It's real hardship for people to have to travel to get that, so really excited about offering that here. I will highlight one other thing on here. We are really working hard on research capabilities. When we're doing cancer care, we want to be able to offer, if there's any type of clinical trials for patients, so that you don't have to travel to Texas, you don't have to go to Rochester, you don't have to go to other places to get those clinical trials. So we are doing phase 1 clinical trials. So phase 1 is like first in human. So these are the type of trials for people who have really struggled and probably have run out of traditional treatments. So we are running those out of the Cancer Institute. So very excited to see that come to fruition. The Illinois Neurological Institute, this is another area where we've been focusing on developing those high-end cares. And that we've listed out here a couple of things for you. The Level 4 Epilepsy Program. I mean, people have to travel far to get this type of care, so very excited to offer that here. NeuroBlate is a type of minimally invasive neurosurgery. So this is always fascinating to me. You know, in the past, a lot of these individuals, you know, you'd have to have a craniotomy and you'd stay in the hospital for an extended period of time. These individuals go home that day or the next day. So it really is revolutionary treatment for patients with brain tumors. Cardiovascular Institute, this is another area that we focused on. We do heart transplants here in Peoria, have had great success, high quality with those, but I want to call out the TAVR program. I mean, we're doing a significant volume of TAVRs here in this area. And for non-clinical people, that's trans-aortic valve replacement. So what that is for individuals who used to have open heart. That was the only option for them to be able to get services. This is a non-invasive approach to this. This is a very exciting program, and we've done over 2,000 of them. We have a celebration coming up, and I'm really excited to see this program continue to grow. Children's Hospital of Illinois. This is our longest standing institute, really providing the highest quality care for pediatrics, really in between Chicago, St. Louis, Indianapolis, and Iowa. Really, that's a large catchment area, and we've developed subspecialties, and really proud of the partnership that we've developed with the University of Illinois College of Medicine here in Peoria. I mean, this is really a tight partnership and really able to deliver high-level capabilities right here in Peoria. We've had a real function or a real focus on on-call digital health. So we recognize that as part of the services we're providing, rural America is really important to us. And there are some small communities we serve that, I mean, transportation is a barrier, access to care is a barrier. So this is a program that we've built over the last 5 years. And one of the things we have, what's highlighted here, is an OB program. So we found there's a lot of individuals who don't have access to an OB. OBs are one of those specialties that are in short demand, difficult to find. And a lot of women have access challenges getting into them. So we have a van that is able to go out and see them women wherever they live. We give them an app, we monitor them 24/7. If they have a question in the middle of the night, we're able to see those moms, connect with them, and escalate them if they need to get to a hospital for care. This has really been a game changer for a lot of women who perhaps wouldn't get any prenatal care at all. So better outcomes for moms, better outcomes for the babies that we're treating. With that, because of some of that work, we did receive really great recognition from Forbes as America's Most Innovative Companies this year, and really proud to continue that into the future. So thinking about that, what's coming next? What's on the horizon? I think I talked to you about this last time. Meadowview Behavioral Health Hospital will be opening. This is for adults, but we send out of OSF Healthcare about 1,000 patients out of our community to Chicago or other places to get behavioral health. So we're really excited to be able to offer this here. It will be 100 beds. This is a partnership with a company called US Health Fest. They offer services in the Chicago market as well, and so we're very, very happy to see this happen. We'll be opening with geriatric care first, and then we will move into the general adult. I think one thing that's a real differentiator with this too is if someone's in a crisis, they are building the capabilities so those individuals can be seen directly and admitted directly into the hospital there. So for our first responders who perhaps struggle with some of the patients that are trying to get access to this type of care, this will be a really great program. The expansion of the Cancer Center. So I mentioned to you earlier our expansion and all the work we're doing in research. We are expanding. We're building another floor into the Cancer Center. Really excited about that. This will allow us to co-house all of our specialists that are treating cancer together, including medical oncology. So we'll have our medical oncologists there, we'll have our surgical oncologists there. You'll be able to get your proton therapy if you need it, general radiation. All the support services are co-located in a single facility. So really, really excited to see that happening. These are some of the faces that are connected to some of this work. It's been a great year in terms of recruiting talent to our area, so very happy to welcome them in here. Dr. Zhang is a research specialist, so really excited to see him. He's the one who is helping us lead those phase 1 clinical trials, building out all of the capabilities we need for cancer research. Robert McWilliams, very excited. He was the second in command at Mayo Clinic, so very excited that he chose to come and help build out our program here. He's the deputy director for our Cancer Institute, and people ask him, now you're moving from Mayo Clinic, which is the top of the iceberg, right? Like why would you make that kind of change? And he's very passionate about this. He says, I believe we can be the world leader in early detection and treatment of cancer. You have built a network that connects rural America, some of our smaller cities, even urban care out of our hospital in Chicago with primary care. He said, I think we can get on the front end of this. We can bring leading research. And he really sees connecting that to the work that we've done with digital health so that clinical trials aren't just available in Peoria. Those clinical trials will be available to all of our rural communities as well. So very excited to see him coming. And then, what's a destination medical center? So this is the last thing I'll talk about, which is really kind of bringing this all together. And this has to do with the expansion and development that we're looking at for St. Francis Medical Center. This is really, if you think about a destination medical center, this is where we'll always serve our community, but we have to have the capabilities to take the highest and most critical types of care, and for those individuals who have to travel for it, because it's not offered in all communities. So this is really an effort that you will see unfolding. Maybe when I'm here next year, we'll have, I don't know if I'm invited next year, I shouldn't be presumptuous, should I? Okay, all right. But maybe, okay, if I get to come next year, we'll be able to unpack that for you a little bit and tell you a little bit about how that's going to look different in terms of Peoria community. So I think that is the summary of where we've been, where we're going. Really thankful to have the time to get to talk to all of you today.
Michelle, the door's always open for you, so. No, great, thank you very much. And I'd be remiss if I didn't mention what fantastic work Michelle's husband, Bill Conger, at the Riverfront Museum. If you've not been down there and witnessed and viewed some of the displays they have on the 250, they just had the Gary Richrath from East Peoria and Dan Fogelberg, and then they're coming up with Richard Pryor. Go. Don't walk, run. Get down there and see that. It's just amazing what they're doing. So with that, well, it's my pleasure now to introduce Dr. Iyer from the University of Illinois School of Medicine, the Dean. So, Dr. Iyer. And
Do I need that?
it's up to you.
All right, Michelle, I'm following the sister's rule of standing on the little footstep.
They brought it.
I learned it from the sister, so. Yes. Good morning, everyone. It is wonderful to be here. Mayor, our deepest sympathies to the family for your loss, so we feel for it. And congratulations, Michelle, on your new role, and looking forward to the fantastic partnership that we've always had between OSF and UEComp. So I thought that I'll kind of talk a little bit about UEComp. I know last year when I was here, we talked about what the College of Medicine does. I'll just start with our mission. Our mission is to advance health for everyone, and our core pillars that we focus on is really education, research, clinical care, and social responsibility. And for us here in Peoria, one of the critical elements of success that we have is our rich collaboration that we have with our healthcare partners. Because as training future physicians and doing cutting-edge research in healthcare, we cannot do that without the collaboration that we have with our partners. So who are we as UEComp? So we are part of one of the largest public schools in the United States. So we are actually number 3. The two schools which are larger than us are actually Wayne State and Indiana. And so how do we know that, how the size of the medical school is really determined by the number of students who matriculate into the medical school class each year. So we have, across the three campuses, so we have three campuses, Chicago, Peoria, and Rockford, and we have 300 students who matriculate into the College of Medicine each year, out of which 65 students come into Peoria for the first year. So we have about 260 medical students here in the Peoria region every year, which is very important and a rich pipeline for the healthcare systems here. We are part of an R1 research institution. So the question is, what does R1 mean? R1 is actually a Carnegie designation, and that is a designation which is given to institutions which bring a lot of research dollars. And so we are, like Northwestern, University of Chicago, UIC, is all part of an R1 research institution. To have that collaboration here in Central Illinois is really something great. We have graduated over 2,400 alumni from the College of Medicine, many of whom have actually leaders in our healthcare systems, and they're also leading organizations not only here, but nationally and globally. As I said, we already have 260 medical students. We also are the sponsoring institution for residencies and fellowships. So being a doctor is a long journey. So after you finish your undergraduate, you have to do 4 years of medical school training. After medical school training, you do residencies, which range anywhere from 3 to 7 years, depending on the discipline. And then if you want to subspecialize, you have another 1 to 3 years of training. So it's a long path. And in Peoria, we have actually grown. We are the sponsoring institution for residencies and fellowship, and we have over 400 residents and fellows here in the greater Peoria community. And this is something that we have grown again. Our participating sites where our residents and fellows spend their time are at OSF St. Francis Medical Center, at Carle Health, and also at St. Joseph's Medical Center in Bloomington. And we just heard approval 2 days ago that St. Mary's Medical Center in Galesburg will also can start a family community medicine residency. And we also heard 2 days ago that we can start a pediatric gastroenterology fellowship, which can start next year. So again, we are in the growth phase and we continue to grow. So that is our GME. We actually employ over 350 faculty. This ranges anywhere from all the physicians to the researchers on our campus, and we have 1,300 non-salaried faculty. So what do I mean by that? Is that physicians who are practicing in our healthcare systems, many of them like to have an academic title. And that academic title actually happens through the university. So they are very proud to be a clinical professor of medicine or a clinical professor of surgery. It has value to them, and so that is the number of people that we have. And we have a growing research footprint through our centers of excellence in research. And I probably am not going to touch on that much today, but as Michelle said, maybe invite myself to talk more next year about that. So I like this picture because one of the strengths that we have as Central Illinois and Greater Peoria is our, rich medical district, I would like to call it. So you can see at the bottom, you see the College of Medicine, across you see Carle, and then across you have the growing footprint of OSF. It's something very impressive that we have here in Central Illinois, a leading, academic institution, large healthcare center with a great vision ahead. I think we are really blessed. So I'm going to shift gears a little bit and talk about where are we headed in the future. So one thing I want to talk about is campus expansion. And so you might ask the question, why do we want to grow the campus? So first, to sustain campus growth. We have significantly grown over the last, I would say our growth has been more in the last 10 years. We have increased our medical students by about 40%. We have doubled the number of residents and fellows. We have grown the number of faculty, but our campus has remained the same, and we have grown research. So we need space for that. One of the areas I will take a deeper dive into is addressing one of the gaps in healthcare, which is women's health, and I'll talk more about that. to also enhance our academic presence. I mean, we are a large academic university, so there's opportunity for growth, enhancing rural health, recruitment and retention of faculty. I think that becomes important. A number of physicians come to Peoria because they like the fact that they can work in large healthcare systems while also being part of the university. Opportunity to expand research and innovation, and then I think us having a significant community impact here in Central Illinois. So what will this new center, what campus expansion project look like? So the reason we kind of want to expand the campus is really around 4 key areas. One, I call it 3-generational comprehensive women's health institute. So you can say, what is 3G? I know we are all doing 5G and 6G right now, but I'll talk about what 3G means in a little bit. We need, as I said, we have grown learners, so we need learning spaces to really foster collaboration. And I think as we look into the future of medicine, one of the things that becomes very important is interprofessional education. Healthcare is a team sport. Everybody has to work together. The physician, the nurses, the physical therapy, everybody, APNs, everybody has to come together. And how do we foster kind of that education and collaboration across the team? Community engagement and gathering spaces. One of our mission is our social accountability. So how do we engage with the community to do that? We need research space, really building out our centers of excellence in research, and we are kind of building out our Center for Health Research. The 4 really stands for health outcomes, health informatics. We are really looking at implementing some of the key interventions and evaluating the outcomes of that, and population health. And the other is Center for Healthy Development in Aging. That's the other center of excellence we are looking at. So really looking at what are the early predictors of healthy aging, and how do we study that, evaluate that, looking whether it is through genomics or other large data to really predict it. There is a saying in the old country, and my grandmother used to say this. She said, the habits you don't form at 5, you're never going to form at 60. That's what she said. And that is very true. So when we try to say aging, how do you age healthy? It doesn't start when you are 60 years old and start thinking about it then. It really starts when you are much younger. So really looking at it systematically is a focus of the Center for Healthy Development and Aging. And of course, as we are getting people, we need faculty and community space. So I'm going to talk about this 3-gen model. What does this 3-generational model for women's health actually mean? So you look at women's health across the continuum, it really breaks up into 3 big segments. So the first one is Generation 1. I kind of look at 0 to 40, right? So that is the foundations of health. So you're talking about well child, adolescent gynecology, you talk about early PCOS and some of the other conditions, very unique to women, contraception, and then important thing about perinatal and postnatal and maternal health. And then you look at Generation 2 is really the bridging years, and this is when you talk about not only postpartum care, but you look at chronic disease management, perimenopause, and then you're looking at CHARM, and what we call is CHARM stands for Center for Health, Advocacy, and Research around Menopause. And then finally, you have the Generation 3, and that is really the longevity and vitality. So again, continuation of the perimenopause care, cognitive health, bone, cardiovascular, metabolic health, and then also identifying hereditary risk. So I kind of look at it at this as a concept to say it's a one-stop shop for 3 generations. So imagine a mom and a baby. So that's 2 generations. So you fast forward 50 years, the baby is now really the caregiver for the mom who has become a geriatric patient. And so as we all know that women do tend to be the primary caregivers of the family and running around and getting appointments. And so how do we really take care of women across the continuum of their lifespan? So we are launching this off with our first midlife and menopause clinic. So this is already up and running in our community. Our concept is one front door, coordinated care, and healthier midlife. So why is this important? So the truth is that 1 in 2 women experience moderate to severe menopause symptoms affecting daily life. These are facts. 1 in every 4 women in the workforce consider leaving the workforce because of menopausal symptoms. So if you're talking about impact on workforce, this is a huge impact on workforce. Average woman spends about 6 to 10 years, women struggle before receiving proper menopause care. And there is zero comprehensive women's health program here in Central Illinois. And so we thought this is a great area to focus and say, how do we provide coordinated care for our women in Central Illinois? So we are kind of working through this in phases. So we have launched our pilot clinic. So the proof of execution is already underway. So we have Dr. Makiba Williams has started this clinic. We know that this is no longer a concept. This is already in the work. It's already implemented. The other thing that I would also say is I know that Michelle talked about the OSF Cancer Institute, and I know that breast cancer women are put into menopause because they are treated with drugs which suppress estrogens, and that's what they do. And so we are actually, Dr. Makiba Williams is actually going to have a clinic at the OSF Cancer Institute because that is a huge patient population and to be able to support them. There is a regional leadership vacuum in the women's health space. And there is going to be a surging demand and proven need. For those of you who've been looking at New York Times and some of the national news, this is becoming a hot topic subject. And not because, it is political, but because there is really a true need to address that from multiple points. Women represent 50% of the population, and it's a workforce issue as well. So we need healthier communities. So what do I mean by coordinated nexus for midlife women's health? So one is access. So we're kind of looking at the one-stop shop. People going to multiple places is always a challenge. So one front door for every midlife woman. And then it's kind of connecting with the resources that are available across the region. How do you connect and give them the opportunity? So you come in through one door, but you have access to multiple resources. And the other key element we're talking about is education. Training the next generation is core to our mission. And so how do you train not only nurses, but residents, and even some of our junior faculty, primary care providers in some of this very important area? And then the focus on innovation. How do you innovate in this space? So these are some of the interdisciplinary programs that would be critical for the midlife care. So one is, as I said, it would be just management of symptoms, but there's also the bone and heart health, there's behavioral health, pelvic and sexual health, and also you kind of talk about cancer survivorship health like I talked about earlier. So again, these are the various elements, and that would be a very integrated path. We do have one of our psychiatrists who will be working with Dr. Williams on mental health care at the clinic. And then we are actually working with both our healthcare partners to say, how can we provide the other resources? So it's not duplicating, but really integrating the care and resources that we have in our community. So again, we talk about the patient experience is going to be very critical, and that will be a theme I'm sure you'll hear everywhere. Michelle alluded to that. It's what is the experience that they get? When patients come to us, whether at any healthcare systems, they are probably at the lowest moment in their lives, but how can we make their experience better so that we actually support them through their journey and the challenges that they are facing? So again, a single point of entry, comprehensive assessment for integrated care, and also opportunities to do some virtual follow-ups. So I kind of put this as Peoria as the hub, but the responsibility is not just in Peoria, but it is in Central Illinois and beyond. As we talked about earlier, there is no program in Central Illinois, or even for that matter, and even up in Chicago, which really looks at this concept of comprehensive women's health. So I think we are serving, in the first pilot, we will be serving all women between the ages of 40 and 65. It gives us an opportunity to engage with rural women in rural communities who have probably more challenges with access. You heard about that from Michelle earlier as well, whether it is for having, pregnancy or follow-up after that. And then working with underserved populations with limited menopause access, and, the door is open to the community. And then we are also very engaged in training. If you look at the data, you will laugh at this, but in medical school, we provide 2 hours of training around menopause for the 10 years of medical school education that they have. But that contributes to a significant amount of primary care providers' office. So this center is really going to be focused on training medical students, residency training, and really also training APNs and others who have interest in this area so we can really grow the pipeline and serve the larger community. So that is our first phase, and then we will be kind of transitioning into the phase 2, where we are kind of expanding the comprehensive women's health to really look at maternal fetal, and then finally going on to the full continuum of care that we had talked about when I started the journey. So this is kind of where we are. So this comes back to our 3Gen model. So now you know when I say 3G, you know what it is. It's just not your cell phone. And our center will focus on research, education, innovation, and advocacy. That is going to be woven into a comprehensive women's health institute. So that's one reason why we need to expand our campus. This one I already talked about. So this is our growth, and so this is why we need this space, is medical students from, you can see 2017 to now, we have from 150 to 260. Our GME programs, we had 11 residencies and 3 fellowships. Now we are at 15 residencies and 15 fellowships, and that does not include the 2 new ones which just started 2 days ago. I didn't have time to update my slide, so that's fresh off the press. And then our GME trainees are at 400 residents and fellows, and growing. Our medical education has a significant impact here in Central Illinois, and we know that based on a study that was done, where we did it with Bradley University in 2021, we know that our residents and fellows, the impact on the Central Illinois community, the direct, indirect, and induced impact is over $95 million. So having a GME program here in the community for Peoria is truly an asset. As we said, it's a great pipeline. I think the next speaker is a great example of the alumni of the College of Medicine Peoria twice around. Economic impact, we engage with the community. It helps with recruitment and retention, and I think it has great clinical care outcomes. Studies have shown that when you have medical students and residents engaged within a healthcare system, their healthcare outcomes tend to be higher than when you do not have learners within the healthcare systems. Why? Because they ask questions and they challenge you, and then they ask you about the best and greatest evidence base and are you applying it to your patients, and that makes a huge difference in how, and plus you see multiple people taking care of the patients. And this is especially true because there is a physician shortage coming. This is the AAMC report. We have anticipated that we'll have anywhere from 54,000 to 139,000 physician shortage in the next, this is not very far, 2033 is like 7 years away. But I think that the advantage we have here in Central Illinois is that we have a very strong pipeline. We have 12,000 applications for 300 spots. So if you ask the question, is there a strong interest? Yeah, absolutely, there is a strong interest. Is it a problem only for primary care? No, we need all specialties, so we need to build them. And the solution is usually to say, can we increase medical schools only? I know that's happening. A lot of medical schools are happening, but it's also about increasing our graduate medical education programs, because to get your license, you need to complete your residency. And the policymakers have sufficient time to take action? No, 7 years is literally around the corner. So we are doing a number of things to help meet the need. We are working on early assurance programs with small colleges around Peoria, Bradley University, Eureka College. We're going to be working with Illinois Wesleyan to have early assurance program directly to our College of Medicine. We are working on a rural pipeline because we know that people from smaller communities tend to stay closer to home than larger communities. We are engaging with our alumni and also building our research footprint to engage them. So this is where we hope to have our new facility. So you know, some of you know the College of Medicine, where College of Medicine is located. And for those who've been in the community for a long time, there used to be an old VA building. That VA building is taken down, and so that's where we are hoping we'll have the new facility, which would look something like this, which would house our clinic space, our students, our residents, and our research centers of excellence. So more to come on the future. With that, thank you for your time.
I don't know what she does in her spare time. That's great, great plans. And you will have a bucket out here for collection for the new building. So feel free to donate, as you leave. Now it's my great pleasure to introduce Dr. Keith Knepp, Dr. Banks, and Mr. Kolb. I've had the pleasure to work with Keith for several years now on the Trillium board, also the Young Minds, and the leadership he gave us there was just outstanding. And it's not goodbye, it's just welcome when we see you next here. So great that he'll be still in our region. So with that, Dr. Knepp.
Thanks for those kind words, Rick. Good morning, it's nice to see you all. I'm Keith Knepp. I'm the current regional president for Carle Health's West Region, which is the greater Peoria region, and likewise a product of local educational institutions from ICC to ISU to U of I times 2, as Dr. Iyer shared with you. I'm just going to start with some reflections this morning. I'm moving into a new role that I want to talk to you about. And then I'm going to introduce my one-up leader at Carle, Matt Kolb, and then we're going to look to Dr. Banks for some updates at Methodist College. 1882. Dr. O.B. Will, Dr. Thomas McIlvaine, and Dr. John Hamilton were 3 doctors in Peoria. And they were bent on adopting the latest modern technology in surgery, which was antiseptic surgery from Dr. Lister, right? Carbolic acid spray, clean gowns, sterilizing surgical equipment. That was the innovation in 1882. But they faced resistance from their colleagues at the other local hospitals, so they started a new hospital, and that became Proctor Hospital. In 1900, 3 deaconesses of Methodist Episcopal Church founded Methodist Hospital and the College of Nursing, 1900. In 1931, Dr. J.C. Thomas and Dr. Hugh Davison left the Mayo Clinic and came to Urbana and what became Carle Foundation Hospital. So those are 3 origin stories of the 8 hospitals across the Carle Health system that spans from the eastern edge of Illinois to west central Illinois, as far south as Olney. All those parts coming together with similar origin stories. And what you hear in those stories is a dedication to service. Deaconesses saying, we need to serve the people of Peoria. And you hear a dedication to technology and innovation. We need to bring the latest in science and technology to come to bear for our patients. Those lead to the mission and vision. I appreciated that the 2 speakers before me, Michelle and Dr. Iyer, spoke to the mission and vision of their institutions. Carle's mission is to be your trusted partner in all healthcare decisions. Our vision is to improve health by delivering world-class care and service. Right? Service, world-class, all the way back to those origins. Yesterday we had a board meeting of our Carle Health West Region Board. Our institutions are still led by community volunteers like they were when they were founded. So Rick commented, he serves on the Trillium Place board. Dennis Triggs has been the chair of the regional board, serves on the Carle Health Board for the entire system. That's where the leadership of these organizations comes from. Yesterday we had a board mission moment. It was about an employee who did a lab test prior to somebody getting a CAT scan and found their kidney function had worsened significantly. And so instead of just canceling the test, this team member took it upon themselves to call that patient's clinic and say, you need to get this person care right now because something's happening with their kidneys. And indeed, they needed to be admitted to the hospital, have several days of inpatient treatment. And that wouldn't have happened without that person owning that moment and living that mission. Also yesterday at Methodist, we had a surgical robotics demonstration going on the second floor right next to our operating rooms, where we had the latest advanced robotics equipment on display for our surgeons to try and use, get trained on. The technology is incredible. You heard about TAVR programs earlier, the minimally invasive surgery that's happening, leaps and bounds better. I had surgery December and using laparoscope, the robot, and it's amazing how fast we recover now compared to the way things used to be. We are still attracting world-class talent to Carle, and it is absolutely true that recruitment is tough. It's tough across the country. It's tough here in Central Illinois, but we still have real pockets of bright spots, producing our own physicians and recruiting new ones. So Dr. Claudius Conrad is a world-renowned hepatobiliary cancer surgeon who relocated to Carle Foundation Hospital in Urbana a couple of years ago and is leading a team that's continuing to make advances that are taking us to the next level. And they're in Urbana partnering with the Carle Illinois College of Medicine, which is a unique collaboration between the College of Engineering and Carle's clinical resources. I think, frankly, it's one of the reasons Dr. Conrad came was the ability to work with that team and to continue to innovate. We're still training nurses and health professionals. So you're going to hear that from Dr. Banks here in a moment. So this has really been a time of reflection for me. Rick alluded to a career move for me. I've had the great privilege of leading the West region of Carle for 7 years now. And my career goes back to 1997 when I started my residency at Methodist, and I practiced in Eureka for a few years before coming back. During that time, I've been part of a team that's brought together 3 disparate hospitals, 3 different medical groups, 3 boards to create a unified medical infrastructure for this community that allows us to take it to the next level. We couldn't make the investments in the robotics program and the cardiac program without the scale that brings. And now being part of this amazing health system that is Carle Health lets us do that at the scale that's needed to meet the needs of this broader community. And yet, leading that system, you still have volunteer board members. I was listening on the way into the news this morning and heard that Meta, under Mr. Zuckerberg's leadership, is going to be cutting some 7,000 jobs, or maybe that was Microsoft. It doesn't really matter, right? It's, the world seems to be controlled these days by 5 or 6 techno-billionaires. And we're so, kind of enamored by it, but we're really influenced by these for-profit companies and really big egos in ways that are disturbing at times. And it's reassuring to me that our healthcare systems are led here by mission-oriented volunteer members of our community that make sure the decisions we're making are in the best interests of all of you, and those investments are in the best interest of our patients. I have this opportunity now to go and lead the clinical services at Heartland Health Services. So Heartland is a federally qualified health center here in Peoria. It has clinics across the greater Peoria area, Peoria and Pekin especially. I'm going to be the chief medical officer, so I'll be applying my clinical leadership skills to that population and that organization, and seeing patients a couple of days a week. back to my own family medicine roots. So a time for me to focus my energy on some direct patient care and bring my clinical leadership in a more focused way to a population that really needs it. But this was an opportunity I didn't want to miss to share with all of you the confidence I have in the direction of this organization. I've been really fortunate to build a strong team of leaders here in Greater Peoria. Some of that has been through the injection of some new talent that came to us from Champaign-Urbana, and Dr. Banks is one of those people. Even more importantly, I've come to know the Carle team. I have confidence in the strength of this organization. It's the right place for us to be, and it's the right organization to continue on this legacy that started so many years ago. Part of that confidence is from the people that I've come to know there. And so my one-up leaders, Matt Kolb, the Chief Operating Officer, I was grateful that he was willing to come today so you could all see his face and hear from him a little bit. I've greatly enjoyed working with Matt. It's one of the things I'm going to miss, not being able to do that every day in my new role, although I know our friendship will persist and our chance to continue to collaborate between Carle and Heartland will continue to persist. So with that, I'm looking forward to hearing the updates from Dr. Banks, but first please welcome Matt Kolb.
Thank you, Keith. Good morning, everyone. I'm really pleased to be with you. I wanted to take just a few minutes and really thank Keith for his leadership. We were reflecting yesterday after the board meeting that maybe like raising children, sometimes in these jobs, the days are quite long and the years are very fast. And so it's hard to believe that just 3 years ago, Carle came to Greater Peoria and has partnered with the teams here. It's been an exciting 3 years. I was also reflecting with Keith over his 7 years of leading in this service area, and I told him, I think you've probably had a career's worth of experience in a relatively short time. If you think about the pandemic and leading through that and all of its after effects and the recovery, and then Keith really sat in the chair through a meaningful and difficult just change management process and transition, leading Carle Health into the community, introducing teams. And as any of you that have sat in that chair before know, it's quite an effort to hold that coalition together, maintain momentum and energy and enthusiasm. And he's done that tremendously well over the last 3 years, and we're just so incredibly grateful to him for that. The thing that I've appreciated about Keith's leadership, one of the many, is really reflected in the conversation this morning, where you can sense a deep and meaningful commitment to community and healthcare in the community. And in every decision that Keith has wrestled with, I know over the 7 years, but even just in the 3 years that we've worked together, what's in the best interest of Peoria and patients in this community has always been the first filter for Keith in making decisions. And I know that will continue in his next role, and we are incredibly fortunate for that and deeply grateful at Carle for his leadership to get us to this point. As a Central Illinois kid myself, I find that to be tremendously important. I think it's a great privilege, as Michelle reflected too, to work in healthcare no matter where you have an opportunity to do it. But the chance to care for your own family and friends, it just makes it that much more meaningful, and has been such an important part of Keith's legacy and leadership, and grateful that that will continue in his next step. When he shared with me his plans, I wasn't entirely surprised by that, but we'll enjoy continuing to work with him in that capacity. And I told him too, whenever he gets around to, setting up his PAC, I'll be one of the first to be in line to contribute to that, as I know many of you probably would be as too. So deeply grateful, Keith, for all of your leadership and continued leadership. So we're excited about the future and what is to come, excited about program development, but as you've heard this morning already, workforce is one of the biggest challenges that all of us face collectively, not just in Peoria, but in Illinois and frankly across the country. And so really excited about some of the program development and efforts that we've made at Methodist College to help bolster that workforce, not just here in Peoria, but across greater central Illinois and the state in general. So thank you for just a few minutes. Thank you for joining me in a moment to appreciate Keith and all that he's done for Carl, for Peoria, and for this community. So I will now welcome, yes, let's pause and thank Keith for a moment if we could. And now my pleasure to welcome Dr. Kayla Banks to the stage, Chancellor of Methodist College, to share some exciting updates. Thank you for a moment of your time.
Thank you, Matt, and thank you, Keith, for your leadership and welcoming me almost 3 years ago to the greater Peoria community and helping this place feel like home for me as well. So as Matt and Keith mentioned, my name is Kayla Banks. I have the profound honor of serving as Chancellor of Methodist College. I am a nurse by training, as you can see on the slide, and that really informs my leadership and informs, frankly, my view of healthcare and the world at large. Also, I have been part of the Carle Health System now for going on 16 years, most of that time in a variety of clinical quality roles, medical education, operations at Carle Foundation Hospital. And so that's really given me a lens through which I view our work at Methodist College as part of the Carle Health System, really being as a driver of kind of future forward thinking and sustainability in the healthcare system. So excited to share a few updates with you this morning. So as Keith mentioned, way back in 1900, the Methodist College was founded as a hospital-based nursing training program along with Methodist Hospital, and that's one of our first graduating classes. And just last year, we had a large community celebration for our 125th anniversary. We welcomed in total just around 500 community members, alumni, friends of Methodist College, Methodist Hospital, Carle Health to our campus, really to showcase our legacy, where we started and where we are. So a few quick facts about the college. We look quite different than we did 125 years ago. We no longer have dorms with strict curfews and dress codes involving white dresses and caps. We have a faculty to student ratio of 8-to-1. The average age of our student is 32 years old. And that is really important when we consider the types of students that we serve. We serve adults who have families, who often are in underemployed or low wage earning positions, many of which are nursing adjacent, but not quite at that sort of living wage that we know the level of that financial income continues to be raised, right, with the cost of living. 45% of our student population identifies as first-generation college graduates or attendees, meaning that neither parent attended a four-year university. So we have roughly 360 students in 8 total academic programs. The majority of those programs are in nursing, both undergraduate and graduate, and also a bachelor's of social work. So really proud to have announced this fall in 2025 the creation of the Academic Investment Program. And what that is it is full coverage of cost of tuition, books, and fees in any nursing pre-licensure program that is paid through a post-graduation work commitment at any Carle Health location in a clinical nursing role after graduation. In its first year, we've served over 200 students in that program, tripling the number of our total applicants to our nursing programs. Also important is that 20% of these participants are from the lowest earning zip codes in the state of Illinois, where the average median household income is $35,000 a year. The average annual salary of a nurse in Illinois is $89,000 a year. So you can think about the generational economic impact that that has for our communities, for these individuals, for our social safety net by infusing more nurses into our region. And as you've heard over and over again, individuals that come from rural communities are more likely to stay and work and serve in the communities where they are. And that's absolutely true for our students. This is incredibly impactful, and some of the things I hear over and over again are, I always dreamed of becoming a nurse. I never thought I would have the opportunity to do that. I never thought a 4-year degree was in reach for me. I have worked at Carle Health in, fill in the blank role for 25 years. I never thought I would have the chance to do this. So it's incredibly impactful. We have attendees of open houses who say, well, I was here to get information for my 20-something-year-old child, but is it crazy for me to think about going to nursing school in my 50s? Absolutely not. Absolutely not. There was a recent article in the Wall Street Journal that, if you're connected to healthcare or just economic development or happen to read the Wall Street Journal, you might be aware of what I'm talking about. It was referencing that nursing is effectively the sustainable career income, of the future. It's the new construction or manufacturing. So that's something that we're really proud of. And we're really working hard to engage these non-traditional students, these adult students who have families, by offering evening courses, weekend courses, online courses where we can, and really, building those wraparound supports. Oh, there we go. No. Sorry. Shot ahead here. All right, so with those wraparound resources, things that we're focusing on is we have student housing located really on the same property as our main campus building. We, this year in fall 2025, really thought about, okay, we've reduced the barrier of tuition, books, and fees expense. What other barriers are there that could prevent really highly qualified, engaged individuals in our community from going to nursing school? So we were able to offer free housing to students who are Pell eligible, meaning that they are considered low income by federal government standards for college attendees. So these students have the opportunity to have free or significantly reduced housing cost right there on campus. So kind of removing one of those barriers. The added benefit of that is as our housing occupancy continued to grow, other students that weren't eligible for the free housing saw that this is a really fun, vibrant place to be. I want to live here too. And so we've got students who are eligible for free housing, literally roommates with individuals who are paying, the full amount. There's no difference in their, status as a housed, student. And so students only know if one of them is paying the full amount or getting it for free if they share that information. So that's really wonderful in building community. We have a weekly on-campus food pantry. We are really proud to share that we have raised over $80,000 in the last year or so, partly with a generous grant that we received from PNC Foundation to support students' basic needs. So utilities, transportation expenses, childcare, rent, housing expenses for those individuals who, aren't able to live in student housing for any reason. And then we also have a student emergency fund. So students who, are at risk of losing their housing or at risk of utilities shut off, we have funds in place to support those students as well to avoid those sort of life altering types of economic issues. We're also looking at expanding our reach, so we're very excited to look to the future and help address some of these provider shortages. We have announced our intent to start a nursing anesthesia doctorate program. Anesthesia services is one of the one of the greatest provider shortages in our region and increasingly across the nation. This obviously could lead to significant delays in care as these individuals are responsible for reducing and eliminating pain and sometimes consciousness for life-saving medical treatment and procedures. And so, we recognize that that's a huge linchpin in maintaining access to care. We recently announced that we hired a program director, Dr. Aaron Oakley, who joins us. He was prior academic leadership in Millikan University in their nursing anesthesia program and will be leading our program as well. We also are looking to start a doctorate in nursing education. So really one of the biggest resource gaps or issues or barriers to expanding nursing education is sufficiency of nursing faculty. So with the nursing shortage, the shortage just gets worse as we move into the nursing faculty space as well. So we're really looking to grow our own, hoping that nursing educators in our region want to stay in our region and building up those skills and those credentials as well. And then more to come. So those are the two that are on the immediate docket for looking at academic year 2027-2028. But we look to continue to build out not only our nursing graduate programs and provider programs, but also additional allied health specialties as well. We are expanding into McLean and Champaign counties, really looking to leverage the learning opportunities across the entire Carle Health system and giving our students those opportunities to see care delivery models that are unique in each of those footprints as well. And then new learning spaces. So to support our nursing anesthesia program coming, we are building out an operating room simulation suite on our campus. So that will be completed later this summer into fall, and we're excited to start making use of that space. All right. So that is a very quick, high-level view of what we've got going on at Methodist College, but we are incredibly proud to build, economic opportunity for our communities, for our students, and it's truly a passion and a privilege to be able to do this work. So thank you.
Keith, Matt, Dr. Banks, thank you. Very great presentation. Questions? Anybody have questions out there? Nobody. I can't believe that. All those folks, no one. I do have one. Dr. Iyer, I know it was just recently talked about, Dr. Vapulo. They're working on research on brain cancer and they're working on a patent. Could you speak to that just real quickly? Or here. Oh.
So research is very broad. So I'll just give a quick overview of that. So when you do research, there is research that you do in the lab. So to identify molecules, and this is done under the microscope, and then we try it out in rats before we bring it out to the phase 1 clinical trials. And so Dr. Valpula has been doing research in our lab, and he has discovered a molecule which can actually have significant impact, actually slows down the growth of glioblastoma, which is tumor in the brain. So what we call bench to bedside takes a long time. So it's good to have a molecule, but now we have to make the molecule and really study, and he's actually done some animal studies which have shown that yes, it does shrink the tumor. So now we have to produce those molecules. We have a patent on it, and it produces the molecule before it enters into the phase 1 trial. So there is a step doing that, and that's what he has talked about. But so we are excited about it because if this works, then that is a huge for patients who have brain tumor, because glioblastoma, as you all know, is once diagnosed, the prognosis is pretty bleak. And so we are very excited about it, so stay tuned, more to come, and we are hoping that this would actually turn out to be a great success story. And you never know, some molecules work and some molecules don't, so we are cautiously optimistic.
All right, anyone else? Well, my shyness showed up. Anyway, want to thank the Paradise again for the great food, great service that we always get here. And also I'd like to recognize, we talked a lot about education and the advancement. I know District 86, the grade school's here, the high school's here. I know Van from Illinois Wesleyan, we created a partnership there working on not only the nursing, the medical part, but we're working also with Caterpillar and some other businesses. So Wesleyan has become a great partner in the development of the workforce here in the Peoria area. So, and we'll continue that. That's one of the things that it's retention and recruitment to grow the area. So we'll continue with that. So with that, I'd like to thank everyone for being here, and have a great weekend and summer. We probably won't have another meeting until August. There's too many events going on during the summer. So again, thanks to everyone. Appreciate it.